baje kumupima mu communauté bambwira ngo aja mu mirire basanga pima 13.
Nkigera mu nkambi imyumvire nari mfise nari nzi yuko umwana akosheje ari kumukubita.
None icyo gihe nari nkiga nyene niga mu 5 noneho rero ubwo nyene nkarinda nyene.
The emergency puts refugee children and their families at a high risk of various forms of violations, preventable diseases, malnutrition, and mental health conditions, among others. This is why Save the Children collaborates with the government of Rwanda, Population, Refugees, and Migration Bureau, and UNHCR to implement child protection, gender-based violence, and health and nutrition interventions in Mahama refugee camp, other refugee camps, transit centers, and urban settings in a bid to improve the lives of children into those locations. This partnership enabled Save the Children to create a safe and conducive environment for all refugees, especially children, and transform their lives by putting in place measurable health and nutrition interventions.
Nuburenganzira bwanjye guhabwa service y'ubuvuzi nk'abandi banyagihugu.
Save the Children cyamfashije ndashijeho neza nshakira umuryango wo kubamo ndi umwana muto, umuryango urandera, abavyeyi barandera, umuryango Save the Children irankurikirana.
Abantu ubwabo mu rwego rw'imikurire bakura neza. Ikindi cya kabiri baba bazi neza uburyo bwo kurwanya ihohoterwa iryo ari ryo ryose.
All children deserve to survive, to learn, and to be protected.
Through child protection and gender-based violence interventions, Save the Children reached over 28,000 refugee children, including 148 children with disabilities, through different sports and recreational activities, which provide occasions of disseminating messages aimed at protecting them from violence and abuse. A total of 54 gender-based violence survivors and 207 unaccompanied and separated children were identified and supported with psychosocial services. This support contributed to improving safety for 97% of children, evidenced by the decline in psychosocial symptoms like nightmares, among others. 83 people, including teachers, volunteers, and child protection staff, were trained in child protection emergency programming. Following this training, the program started recording the willingness of trainees to devote themselves to home-to-home outreach and reached 120 neglected children who were referred to case management for support. 10 existing community-based child protection structures were supported to raise awareness of the prevention of child neglect, abuse, and exploitation in the camp and host community. Around 1,644 people were reached through awareness sessions. A total of 100 parents were trained on safe families, communal approaches, and 85% of them were visited and displayed improved care to children and remarkable decline in severe punishments to children. Additionally, Save the Children was also able to train 2,000 refugees on the Safe Families program. As a result, 71% of caregivers reported that they apply positive parenting skills in their homes, while 52% increased their knowledge of child protection.
Baratwigishije yuko umwana afite uburenganzira bwo gukina, baratwigisha yuko umwana akoze ikosa intuze kumukubita atari byiza.
Muri CFS baratwigisha indero, bagatwigisha gufasha abavyeyi. Abavyeyi banje barishimira yuko babona nje nishimye cyane muri Save. Bakishimira yuko babona mvuye gukina kandi bakabona nta kibazo.
Ubwitabire bwabo bwariyongereye kuko iyo umwana aje akabona uramuha service runaka agira ishaka ryo kugira gute ryo kugaruka.
Adere arashora kumenya ko isaha yo kujya kwigigeze akiyuhagira akiyambika akagenda kwiga. Ibyo byose ni impinduka mbona yagiye akura aho muri Save aho bagenda bamwereka ko nawe ashobora kwiga nk'abandi agakora nk'abandi.
Through health interventions, Save the Children recorded over 59,000 consultations against over 67,000 consultations planned in Mahama refugee camp from August 2022 to August 2023. To ensure preparedness for the outbreak, Save the Children trained 140 community health workers who later supported in vaccinating over 13,000 children against polio in the Mahama refugee camp. In April 2023, Save the Children started delivering comprehensive emergency obstetric and neonatal care, including cesarean section and blood transfusion services. As a result, over 2,000 successful deliveries, including 113 C-sections, were recorded in Mahama refugee camp health facilities. On that note, Save the Children recorded 444 referrals of women with complications to secondary and tertiary service providers compared to 663 health-related referrals in 2022. Hence, referrals of women with complications declined by 33% because of medicalized health center services. The partnership with the secondary and tertiary health service providers contributed to the decrease in mortality rates from 17 deaths in Q1 to 10 deaths in Q4 2023.
Bahise banyakira vuba umurokure vuba nta kibazo na kimwe yari yakagira.
Ariko ubu uye kubera tubyarira hano mu nkambi byaradufashije cyane kuko abantu bagumye badusura.
We feel that this service do not only help the refugees but also the host community.
Through the nutrition program, Save the Children screened over 80,000 children and over 1,000 pregnant and lactating women for malnutrition. Of those, 146 cases of malnutrition were identified and treated. Of those treated cases, 94% were cured and discharged from the program.
Uraza umwana agwingiye nta bwenge amenya ariko kuba barabimuhaye akabivamo uba afite ubwenge bwinshi.
Nzaba umutica peretita.
Save nyene nayishimira kuko yamfashije konsa abana bakaba bamfashije kumpa icyo gikoma nkonsa abana.
However, there are still challenges that hinder Save the Children from reaching more children and their families in need of humanitarian assistance, especially funding gaps that affected Save the Children programming in Mahama and Nyabeke refugee camps and urban settings. Other critical challenges include the new influx of refugees due to the rise of armed conflicts in the Democratic Republic of Congo and calls for new investments in health, nutrition, gender and child protection, which Save the Children can't afford if impact investors and donors don't support such noble causes. The ongoing partnership with the Population, Refugees and Migration Bureau will enable Save the Children to improve the quality of service delivery to the people we serve and save more lives in refugee camps and host communities.